Welcome to The Explainer. Today we're looking at a pretty incredible story out of Bulukumba, Indonesia. It's about a community facing a massive mental health crisis. But their solution? Well, it didn't come from a hospital. It came from something way more powerful. The simple idea of treating everyone like family. So let's just start with this question. I want you to really think about it. What if, in your town, 1 in every 4 teenagers showed signs of depression? I mean, that's a staggering thought, right? But for the people of Bulukumba, this wasn't just some hypothetical question. This was the reality they suddenly found themselves facing. And this number, 1,313, this was the wake-up call. It's not just a statistic, you know? It's 1,313 individual stories. 1,300 kids in distress. And yeah, that number, as big as it was, turned out to be just the tip of a much, much larger iceberg. Health workers realized pretty quickly that if this many teenagers were struggling, well, the problem for the entire population had to be absolutely huge, and most of it was probably hidden way below the surface. Okay, so just how big are we talking here? Let's break down the scale of this problem. So the community was basically dealing with 2 different problems. You had the visible part, right, the tip of the iceberg, things like schizophrenia, the more severe disorders that people could see. But then hidden beneath the water was this massive, almost invisible crisis of depression and anxiety affecting thousands upon thousands more people. I mean, look at this. This chart really puts it into perspective. For every 1 person with a severe disorder that people knew about, there were over 4 others struggling quietly with things that often go totally unnoticed. And when they saw that, well, that's when they knew they had to try something completely different. So, faced with this absolutely huge need, a local health official, a guy named Arham, he came up with an answer. And it was based on an idea that's, well, it's really simple, but also incredibly profound. He called the program BIJANTA. Now, technically, it's an acronym. It stands for Bulukumba's Integrated Mental Health System. But the part that really matters, the part that's so important, is what it means in the local language, our family. And that one little phrase, it changed everything. See, that philosophy, that idea of family, is what turned this from just another government program into a real, honest-to-goodness community mission. So how did they actually make it work? How did BIJANTA operate? It all breaks down into 3 simple but powerful steps. First, find. This was so important because they knew that stigma makes families hide their relatives away, so they couldn't just wait for people to show up. They had to go out and proactively find them. Second, integrate. This wasn't about just sending someone to a doctor. It was about plugging them into a whole network of services for complete care. And finally, number 3, empower. Because this is the real goal, right? It's not just about treatment, it's about helping people get back on their feet and become empowered members of society again. And when we say integrate, we really mean it. This was not just a health thing. It was like the entire community started working together as one big machine. You had the police, social services, even the civil registry office, which is super important because you need an ID to get health insurance and other services. The whole system was designed to work together. So what happens? What are the results when a whole town decides to treat mental health like a shared family responsibility? Well, to put it simply, they were dramatic. I mean, just look at these numbers. Because they were actively looking for people who needed help, the number they found and got into the system, it more than doubled in only 2 years. Now, that doesn't mean more people were getting sick. No, it means the walls of stigma were finally starting to crumble. But the success wasn't just about the numbers. This was about changing and even saving lives. People who were completely isolated were now getting IDs and health insurance. They were taking their medication more consistently because, hey, someone was actually checking in on them. The impact was so huge that this little community's model started winning international awards for its smart and, really, its deeply human approach. But, you know, finding and treating people, that was really just the beginning. The real mission of BIJANTA is still evolving, and it's pushing towards something even bigger, and that's full empowerment. And this quote from the founder, Arham, just says it all. The goal is to see people with mental illness as empowered individuals, not burdens. It's a total shift in perspective, right? It's not about looking at a patient and seeing a problem. It's about looking at a person and seeing their potential. So to make that vision a reality, the community is now working on their next big dream, a dedicated rehabilitation center. Think of it like a bridge, something that connects the medical treatment side of things with a full, productive life back in the community. It's about making sure that recovery doesn't just stop the moment someone leaves the hospital. So the story of Bijanta, it's really so much more than just a successful health program. It's a powerful lesson, and it kind of leaves us with this final question to think about. What could your community, what could our communities achieve if we all started treating everyone as family? It makes you wonder, doesn't it? It suggests that maybe the solutions to our biggest, most complex problems are actually rooted in something incredibly simple.